Okay. Hello, everyone. Yat Losum Chinyavo. Hello, and welcome to today's pre-application webinar on electronic case reporting for tribal nations, a tribal data sovereignty project. Request for applications. My name is Tyrone Peterson, and I am a project coordinator at the National Indian Health Board, and I will be moderating half of this presentation with my colleague, Sophie. So the purpose of this webinar is to go over some of the important information in the RFA that you will need to help you determine if this funding opportunity aligns with the needs of your tribe or tribal organization. Thank you all for being here. So before we begin, let's go over some housekeeping and logistical details. This webinar is being recorded. So by joining this webinar, you are giving consent to being recorded. So if you don't want to be recorded, we ask that you drop off the call now. So I'll give you a couple seconds to do that. So all registrants will receive a copy of the slides following the webinar. And if you have any questions during the presentation, please feel free to enter them into the Q&A or chat box at any time, and we will be addressing them later in the presentation. So we want to remind you of NIHB's mission statement, which is NIHB was established by the tribes to advocate as a united voice of federally recognized American Indian Alaska Native tribes to reinforce the tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health and well-being for our people. We'd also like to mention our public health policy and programs vision statement, which is working together to empower sovereign tribal nations to improve equity policy and public health systems that build thriving Native communities now and for the next 7 generations. So in today's webinar, some points to keep in mind is that we will be reviewing key aspects of the request for our applications, or RFA. Keep in mind that we will not cover everything in the RFA during the webinar, so it's important to read the entire document thoroughly before preparing your application. So let's get ahead and jump into the details. It's important to highlight this disclaimer, which is the RFA is supported by the Centers for Disease Control and Prevention of the United States Department of Health and Human Services as part of financial assistance awards totaling $1 million for improving tribal access to electronic case reporting data, fully funded by CDC and HHS. The contents of this RFA are those of the authors and do not necessarily represent the official views or endorsement of CDC, HHS, or the US government. So now I'd like to introduce the program project staff who are here today to support this initiative. From the National Indian Health Board, we have Sarah Price, who's the Associate Director of Public Health Policy and Programs. If you want to say hi, Sarah.
Hi, everyone. Welcome. I'm Sarah. I'm happy to answer any questions. And thank you all for joining us today.
I'll tell you what, let me step into the meeting and
And then we have Sophie Sambajwe. She's the project lead of this eCR project. Can I say hi, Sophie?
Hi, all. I'm glad to have you all on this call, and I will be giving the second part of the presentation. So thank you for being here.
And then we have me, project coordinator, to support Sophie and Sarah on this project. And then from CDC, we have Sarah Sabonia, the eCR onboarding coordinator. Is she here yet?
Yep, just got here. Hi, all.
And then we have Melinda Thomas, who's the lead for eCR Public Health Agency. Melinda, are you here?
No, Melinda wasn't able to join. She may be able to join later in the meeting.
Okay. So we are the key people who will be helping throughout the process and answering any of your questions. Okay. So our objectives for today's webinar are straightforward: to orient potential applicants to the RFA, to provide a brief overview of eCR for tribal nations, to discuss eligibility requirements and application processes and timelines, and of course, to respond to any of your questions you may have. This is the funding announcement that was released in the RFA. The National Indian Health Board is offering a funding opportunity for tribes and organizations designated by tribes such as tribal consortia or tribal epidemiology centers to receive or improve the use of electronic case reporting data. So the purpose of this funding seeks to empower tribal nations or TECs to receive timely eCR data and improve their public health efforts in disease tracking, case management, and contact tracing. The goal is to make sure tribes have the necessary tools to act swiftly and effectively on public health information. Now let's take a brief look at eCR itself and its relevance to tribal nations. So it's important to recognize that tribal nations have the legal authority to receive case reports on conditions of interest as defined by tribal law. This sovereign right is foundational to the role of eCR in tribal health efforts. So what exactly is eCR? So according to CDC, it is the automated exchange of case report info between healthcare facilities and public health agencies, which does include tribal health departments and TECs. eCR provides significant advantages such as delivering timely data that helps enable quicker investigations and more effective public health responses. And currently, only 3 tribes are directly receiving eCR data. This funding we're discussing today seeks to expand eCR access to more tribal nations, increasing greater participation and improving public health outcomes. Now let's walk through the timeline for the RFA process. The RFA was officially released and advertised on December 16th, 2024. The pre-application webinar is being held today and as part of the application preparation process. Applications are due January 24, 2025 at 11:59 p.m. Eastern Time Zone. Please submit your application in either PDF or Word document format and send it to Sophie. Her contact information will be on the next slide. The evaluation process will run from January 25th through January 30th. And finally, the anticipated award notifications will be sent out on January 31st, 2025 by email. So mark your calendars for those key dates. So like I said, the application deadline is January 24th, 2025 at 11:59 Eastern Time Zone is the cutoff time when you can submit your application. If you have any questions regarding the application process or any questions in general, you can reach out to Sophie at SSEMBAJWE@NIHB.org using the subject line as eCR for Tribes application. Please be sure to attach or submit your application as a single Microsoft Word or PDF document. And note that we will not accept applications by postal mail or fax. So make sure to plan ahead and submit your application on time. So now this part of the application is the eligibility. To be eligible for this funding, you must meet the following criteria. You must be a federally recognized tribe or tribe organization as defined by the Indian Self-Determination and Education Assistance Act. TECs that are designated by tribes to receive their eCR data are eligible to apply. Your tribe or organization should have strong interest in the areas of surveillance, data sovereignty, and or eCR. So at this point, I'd like to hand off the next half of the presentation over to my colleague Sophie, who will continue with the presentation and dive deeper into the next steps of the app. So Sophie, over to you.
You, Tyrone. Next slide. So we're going to dive into the funding overview and categories of this eCR grant. The grant is divided into Category A and Category B. Category A is the implementation of direct eCR connection. The funding amount for each applicant will be up to $200,000. We are looking to fund up to 3 tribes or tribally designated organizations that will receive this funding for implementing a direct connection to receive eCR data. For category B, this category focuses on strengthening partnerships for eCR data exchange. And this funding amount will be for $75,000 for each applicant, and up to 2 tribes or tribally designated organizations will receive funding to enhance data existing through indirect eCR data sharing partnerships. So there are key differences there in the categories of funding. Next slide. So more about category A, which is implementing a direct eCR connection. Applicants for this category must not have previously received NIHB funding for the purposes of directly connecting to eCR. We just want to make that clear. You must achieve the 4 objectives, which I'll go into on the next slide. And tribes and their designated organizations can apply collaboratively under one sub-award from NIHB, and one entity must serve as the primary applicant. Next slide. And for category A, there are 4 main objectives. The first objective is preparing for the eCR implementation process, and there are required activities around that that we'll talk briefly about, and you will see in the RFA. Objective 2 is focused on connecting. My apologies. Is everyone able to see the slides?
Yes, the slides are showing.
Okay, good. Just making sure. And then objective 2 is related to connecting to eCR, all the processes around connecting, connecting with IT, CDC, APHL, CST, and the platforms involved with connecting to eCR. The third objective will be authoring, which focuses on putting together geographical criteria and your cases and condition definitions for the cases that you are looking to receive through the eCR platform through AIMS. Objective 4 involves coordination and partnership with partners that you're implementing eCR with NIHB and CDC as the overall funder of these activities. Next slide. So more about category A. The work plan in the RFA is pre-populated with required activities, and these activities are necessary for a successful eCR connection and or reporting to NIHB. So they will be required, and all grantees under category A will have to include those activities in their work plan. And applicants can expand on the work plan table and add additional activities as needed, depending on their needs and processes and their objectives. Next slide. So NIHB recently released an eCR roadmap for tribes and TECs that we're very proud of. We really want this to serve as a resource for tribes, TECs, tribally designated organizations with public health authority to connect directly to eCR. So this is very pertinent to activities that will be around category A, which is connecting directly to eCR through the APHL AIMS platform. There is a link to the eCR roadmap here. It can also be found on our website, which we're launching a new website. So there'll be a lot of new exciting visuals, resources that you can access. And we will be sending out more information when the new website launches in the next coming days. Next slide. So category B of the funding is focused on strengthening partnerships for eCR data exchange. applicants should, to be eligible for this category, should currently receive ECR data indirectly through existing collaborations with state and or local health departments to be eligible. In addition, applicants who are in the process of developing data sharing agreements with state or local health departments will also be considered, and consideration for receiving this funding will be based on the timeline of the agreements that you are in the process of gaining with either state or local health departments. State and local health departments themselves are not eligible to apply for this award directly. Next slide. So more about Category B. The projects under Category B can be broad and flexible, but should enhance the ability to use or receive ECR data from existing partnerships. Some examples, these are not limiting grantees for from proceeding with different projects. These are just examples, some of which are analyzing existing public health related laws and practices related to current ECR data sharing, looking at devising solutions to enhance existing ECR processes and workflows between tribes, state, and local health departments. Another example would be developing mechanisms to use transmitted ECR data to enhance public health surveillance capacity and disease investigation. Another one could be creating data dashboards to track public health indicators with the ECR data and broader surveillance data. And then using eCR and other data to conduct strategic analyses and plan public health action is another example. Next slide. So I'm going to go a bit into the project requirements that all selected sub-awardees must meet. So all awardees would need to complete all activities in an agreed upon work plan. So we do have work plan templates that we have provided, and the pre-populated activities are required. Additional activities, as we mentioned earlier, can be added to those work plans. Awardees would need to sign and return a contract with NIHB outlining funds, distribution schedule, tribal points of contact, and deliverables. Awardees would need to designate a main point of contact for communication with NIHB. They would need to permit NIHB to share project success, lessons learned, and deliverables completed through this project. And awardees would need to participate in peer learning, training, awardee conference calls as they come up, as well as individually scheduled calls with NIHB, and in some cases, NIHB and CDC. Awardees would need to conduct evaluations and participate in technical assistance activities as well. And finally, awardees would need to submit a final report and financial statement to NIHB by the end of the project timeline. Right now, we have it slated for July 31st of 2025. And the reports would be submitted to me with my contact information, sembajwe@nihb.org. The project duration is about 6.5 months, and project extensions will be approved as needed on a case-by-case basis. Of course, that will be revisited once you have been given the award and you're actually in the ECR implementation process. Next slide. So support from NIHB and CDC to sub-awardees will include, of course, funding, specified amounts of funds to support project activities, providing technical assistance through expert support from NIHB staff and or CDC staff as well. Support would also include peer learning opportunities through webinars and conference calls to facilitate knowledge sharing among tribal partners. And support would also include networking and resources, which includes connecting to learning communities, of which we have one, a tribal public health data modernization learning community that some of you may be aware of. Also, support would include connecting to national networks, TA resources on eCR and data modernization, and various data sovereignty resources and efforts in that area. And tailored support can be provided to grantees as needed for project success. Next slide. And this is more about the application itself, which is on page 7 of the RFA. Section A is tribe and contact information, which is can be looked at as the basics of the application, the key contact information, the tribal organization, main address and important details. Section B is the application narrative, which can be seen as what you currently do, what you plan to do, and how you will implement it. Section C is the award budget and supporting documents, which includes several attachments, including the budget narrative and line item budget, letter of support, indirect cost rate agreement, if it's applicable to your situation, financial audit, and W-9 form. And then section D is your proposed scope of work, which will be in the work plans that can be seen as the deliverables of the project. And this is on page 23 of the RFA. I just wanted to note that the work plans are different for category A and category B. They have their templates that are specifically for each category. So just be sure if you're applying for category A, you're working with the category A work plan template and the same for category B. Next slide. So a bit about the selection process. We'll review the review committee will consist of a team of qualified public health professionals with expertise in Indian country, public health, surveillance, and eCR. Just note, incomplete applications will not be reviewed or considered for selection. And finally, applicants will be notified of their application status by January 31st, 2025, as Tyrone mentioned earlier. Next slide. So these are just a few resources that we wanted to provide to you as well to assist in the eCR grant application process. The eCR roadmap we've included here, the eCR RFA document in which you will be filling out information and submitting your application. We included a few resources on just guiding you on the process of developing project objectives, putting together budget narrative, and we've also provided an example of a budget narrative just to serve as a guide if that is necessary for your situation. All right, next slide. Now we can open it up to questions. We'll be happy to take any questions any of you have, and we hope this session has been helpful to all of you as you consider applying for this funding. Are there any questions in the chat?
We've got a comment in the chat from Krista. I'll read it because it's a very nice one. Thank you, Krista. Hi all, I'm here to let you know interested applicants know that this is a great endeavor for tribes. NIHB and CDC have been great and exceptionally helpful to us. Good luck to all applicants from Turtle Mountain Public Health Department's eCR team. Thank you, Krista.
Thank you. Yes, we've worked with Turtle Mountain. Thank you so much for that. Okay. I see a question that came in. Will tribal coalitions just need letters of support designating a lead tribe rather than a formal organization? Let's see. Sarah, could you?
Yeah, so it depends on what the authority of the coalition is. So if the coalition has documentation from tribal governing bodies designating them to receive this data, that would be what we would need on our end. If it's a affordable tribal consortium, anything like that, then there's that kind of authority there, and that's kind of up to the tribes to make sure that the correct authority is there, and then the tribal consortium to demonstrate it. If it's an informal coalition that's forming right now, you would need some sort of letter from all those from all the tribes participating that you would receive data from. If you have letters from one lead tribe, that tribe would be, if that's the only tribe you have the letter for, that may be the only tribe you can receive data for until you have evidence that other tribes have given you kind of that authority to act on their behalf. But yes, if it's multiple tribes acting together, you would designate one lead tribe.
Okay, another question came in, and I think Sarah, you can also answer this. What exactly is the financial audit with schedule of findings? Is that the most recent financial audit of the tribe?
Yep, that's exactly what we're asking for, just your most recent financial audit.
We have a few more minutes for any additional questions or comments.
Sophie, if you want, I can talk a little bit about some of the resources offered on our side. Would that be helpful?
Yeah, that'd be great. Thanks, Sarah.
Okay. Because I know that if this is something you're not familiar with, it can seem kind of daunting, but eCR is collaboratively a project of us at CDC, the Association of Public Health Laboratories, and also the Council of State and Territorial Epidemiologists. So each of those entities has an eCR team, and depending, if you're have questions about how to make a technical connection, what that looks like, what you need, then we'll connect you with the APHL team, and they can walk you through all of that. And a lot of this is also detailed in the lovely roadmap, but just some highlights. There's also CSTE has what's called an authoring support associate. So they have trainings, but they also have a designated person who would be assigned to your tribe or your organizational entity to help you figure out, say you want to get all cases of the flu reported and your tribe has decided flu cases should be reported to the tribe. They'll help you figure out, what your criteria should be. Do you want cases that are lab confirmed? Do you want cases that are suspected? So, I mean, there are people who will sit down and kind of walk you through, on the screen showing you exactly how to do this. So I guess just don't be intimidated. Like Krista said, we're friendly and we do have support.
Thank you so much, Sarah. That's very helpful to hear. Thanks for the detail. We do have another question. If our tribe is main applicant, is a tribal resolution okay to submit instead of a letter of support? Usually that is what we do for grant applications.
Yes, that is perfectly acceptable. When we say letter of support, what we're looking for is some indication that your tribal governing body knows and supports your application. So a resolution is absolutely an appropriate document to submit.
Thank you. And where would we access the recording? So that we will be sending out the recording with a follow-up email probably within the week. The recording will also be available on our website, on our new website. And if you are also part of the tribal public health learning community that we have, we'll also send out information on the eCR RFA, the recording, and other eCR resources. All right. Well, if there are no other questions, we'd like to thank everyone for joining today, and we look forward to receiving applications for all of you interested in moving forward.
Thank you. And really encourage you, if you do have any questions about the application or just need any assistance, please reach out to us. We cannot provide assistance that would give you an unfair advantage, but we can provide assistance in understanding eCR, thinking through projects, how to do the application. So we really want to make sure that this is accessible. We know this is a new topic for many of us, all of us really. So yeah, please reach out to us if we can help in any way before the application deadline or after if you have questions and you're thinking about this, but you're not quite ready.
Yes. Thank you, Sarah. Definitely. All right. Well, thank you all and have a good day, everyone.
Thank you.
Thank you.